Good afternoon. Today we're going to cover part one of our musculoskeletal system, looking at sprains, strains, and dislocations. A sprain is a partial or complete tearing of the ligaments that hold various bones together or form a joint. A sprain can occur when a joint is moved more further than it can handle, forced during trauma, during a fall, past normal range of motion. There may be some twisting as well, like going down the stairs and twisting your knee or ankle. The typical areas are the ankle, knees, and the wrist that are commonly sprained. Signs and symptoms. Sprains are graded into three. Grade 1 is mild, grade 2 is moderate, grade 3 is very severe, complete tearing of fibers. So with mild, you have tenderness at the site, minimal swelling, loss of function, no abnormal motion. So this person can probably stay home, put a little bit of ice on there, wrap it, keep it elevated, do okay. A moderate grade 2, there would be more severe pain, especially with weight bearing, swelling and bleeding into the joint, and some loss. So this person will require some downtime from work, would require some probably pain medication, wrapping that extremity, putting ice on it, elevating it, and making sure that they are not walking on it, because that actually aggravates the situation. Grade 3 is where we have severe complete tearing of fibers. Pain may be less severe, but swelling and loss of function definitely, and bleeding into the joint are definitely a problem. So once again, this person here, if it is a major tear, they may have to go into surgery to get that repaired. That's dependent on the physician. Diagnosis. The doctor goes in and he looks at the extremity. He does x-rays to rule out if there's fractures or even fracture fragments of the bone. Treatment, like we say, it's acronym of RICE, R-I-C-E. So R is for rest, ICE be for the eye after injury for the first 24 to 72 hours. Now, we do not want to use heat quite yet, and not until after 72 hours, which would increase blood supply to that area for healing. But right now, we want to use ice, and that will help with shrinking the swelling. Compression, we're going to use elastic bandage. Wrap it up. Ace bandage would work as well. We don't want it too tight, but just enough to give it a good snug fit. And then elevate the extremity. That also promotes venous return and helps with swelling and bringing that back down. So once again, the goal is to protect the joint, the ligament, until it heals by scarring. So the treatments, like I said, grades 1 and 2 are resting the joint. We don't want any weight bearing whatsoever, so they'll probably use crutches. And then we're going to give them anti-inflammatory drugs like NSAIDs, typically like your ibuprofen would work quite a bit. But once again, remember, these NSAIDs need to be given on with food because it can be hard on the stomach, and making sure that they space them out every 4 to 6 hours. So there's a maximum amount that you can take in a 24-hour period. So make sure you are teaching the patient about that as well. Signs and symptoms. Right now we're doing strain. So this one could be a history of overexertion. You have soft tissue swelling, you got pain, you got bleeding if the muscle is torn. So this is different from a sprain, but this is a strain. You strain the area you stretch the muscles a little further than they can go. So this is by pulling or tearing of a muscle, a tendon, or both. A strain occurs by trauma, overuse, overexertion of a joint, however that is. So the most common muscle strain occurs in the back muscles. So definitely here, make sure you are lifting your patients using body mechanics, correct body mechanics and stuff. Muscle strain do occur to other skeletal muscles, usually like your hamstring, quadriceps, and your calf muscles as well. So those can be very painful and can limit the amount of walking and stuff, mobility the person can have. So alternative therapies, soothing sore muscles. You have arnica that can be purchased. It's like an ointment or essential oil where you actually work it into the area that'll soothe the muscle. You have valerian and kava, which could be brewed as a tea, also helps relax those muscles. And to make it a little more tasty, you could actually add honey or apple juice to make it more palatable. Nursing treatment and nursing management, ice and compression should be applied immediately with rest. And when we put on ice, we're only going to do it for 20 minutes at a time. So out of an hour, so 20 minutes off, usually 20 minutes on. But, you know, give it a rest. Make sure you are not putting the ice directly on the skin, that they do have a barrier. That we do not want to cause more problems with the skin having direct ice on it. Actually can damage it and stuff. When compression is used, make sure that the compression is not too tight. Make sure you're checking sensation and adequate circulation as well. Sensation would be looking at their fingers, touching their fingers and the toes or whatever, and making sure, can they feel you? Circulation, once again, looking at the toes, the fingers, are they pink or are they white? Looking at the capillary refill, feeling the pulses, and the swelling, is it too much? Can you still put a finger or two underneath the wrap? You should be able to do that. It is not to be so tight that it is a tourniquet. Next, continuing on with our treatment, we are going to use heat. Usually after 48 hours. Heat allows the muscles to improve the perfusion, getting more oxygen, nutrients to that area, and improves the healing time as well. So once again, we're going to use anti-inflammatory medications for pain, muscle spasms if they're present. You may use muscle relaxers. Once again, that will be up to the doctor to prescribe. Patient is cautioned again against re-injuring it. So this area is going to be tender, is going to be more susceptible for additional injuries. And if there is continuing injury, or perhaps the area did not heal correctly, the doctor may require surgery to repair it correctly. Our next area is dislocations and subluxations. Dislocation is like a stretching, tearing of a ligament around the joint. Subluxation is partial dislocation by trauma. So dislocation, if you think about it, it's like, think about like your shoulder or your hip joint can be dislocated. We cause major pain because the tendons, ligaments, the muscles are not meant to stretch in that direction. Signs and symptoms, you know, we identify the history, outside force, whatever. It may have been a motor vehicle accident, a fall, or whatever. Severe pain may aggravate any type of by movement. If they're trying to move their arm or their leg, you're definitely going to have muscle spasms going on. The joint itself may look a little bit strange because it doesn't work right, it doesn't move, it's popping, something going on. and the doc will do some x-rays to show, yep, it's dislocated or so. Dislocation, once again, treatment. We will do reduction of displacement, and typically that'll be under anesthesia. Once again, various levels of anesthesia, usually conscious sedation, that allows the muscles to relax enough to be able to manipulate the joint to get the bone and everything back into place where it's supposed to be. Now, nursing management, the area, yes, we're going to do rest, we're going to do pain control and heat and cold applications, but not only that, you have a patient that receives some type of sedation. So before they go home, they first have to have a driver because they can't go home by themselves driving under sedation. And number two, there should be a recovery time, making sure that they're awake, alert enough, and can maintain their own airway, are able to swallow and stuff. The pain is under control. They got motion in that extremity and stuff. So before we move on, that is what we're supposed to do.